Balance is important at every age. Whether you are 20, 30 something and you're having a baby, your center of gravity, your center of balance changes with the pregnancy, so it's important for you to be conscientious of the balance at that point. But also as we get older and we age, we know that we get a little bit weaker in our hips and our core, and sometimes with weakness we get increased risk of falls, especially over the age of 65. And balance is always important. We need balance to help us walk on level ground as well as walking in stairs, and it helps us to continue to be independent in our homes. If you feel like you're falling or you're starting to lose your balance, make sure you mention that to your doctor, because one of the signs of falling is a previous fall. And a fall does not actually mean you hit the ground. A fall means losing your balance and having to catch yourself on the wall or leaning up against an object to catch yourself. So just make sure that everyone's aware of the definition of a fall. So it's always important to make sure you have a sturdy surface to hold on to. So whether it's the back of a chair, can I have you come around this way, Carly? So you can hold on to the back of a chair, or you can hold on to your kitchen sink or a counter at home, tabletop, something like that. That's about little under waist height, so it's comfortable to rest your hands on there. And a couple of exercises we're gonna do. Main thing we're gonna do is we're gonna work the leg muscles, so your glute muscles as well as your hip muscles. And I really want you just to start by marching. So let's have you hold on right here, Carly. And go ahead and just march. This is very important because as you're walking, you have to use one leg and then the other. So you're building up strength as you stand on one leg, but also as you move the other leg, because we need hip strength and glute strength. As you're standing here and as you lift one leg up, as you do when you're walking to bring it forward, you have to have strong hip muscles on the side that you're standing on. If you don't have strong hip muscles here, then you don't have the stability in your hips and makes you more off balance. Okay, another exercise you can do is you're gonna just kick your leg gently out to the side, just a little ways, calling this side kicks or hip abduction. And make sure you do both legs. Another one is hip extension or kickbacks, and you're gonna do this gently and just back like this. The important thing is to make sure you stand up nice and tall. Don't want anyone leaning over their chair. And generally we tell patients to do 10 to 20 repetitions of each of these exercises. Another thing you can do is just standing with your feet close together and trying not to hold on to anything and see how your balance is. Do this with your eyes open or your eyes closed. If your eyes are closed, it's a little bit more difficult. You can also stand one foot in front of the other. Again, when you're doing this, I'd have a chair or something to hold on to, okay? And again, make sure you do both sides. And if you're gonna work on these balance activities, I would have you do it for 20 to 30 seconds at a time, 3 to 5 repetitions at a time. It's important to do these exercises every day, because if you only do them once in a while, you're not gonna get the benefit. But if you do them every day or even twice a day, you're gonna get a lot more benefit from these exercises and help improve your balance, and if nothing else, maintain the balance you have so you don't go backwards anymore and make it harder for you to live independently.